Welcome to yet another time where we update the members of the public on all things health in Tobago. We do apologize for the late start. However, we are happy to have you here with us. Welcome to all our viewers on Facebook Live and on TTT, wherever you may be viewing us. My name is Rian George. I am the Senior Corporate Communications Officer at the Division of Health, Wellness and Family Development. It is indeed my pleasure to be here to take you through this afternoon's media briefing. I would just like to introduce our panel to you. And leading off our panel, we have Councillor Tracy Davidson Celestine, our Secretary of Health, Wellness and Family Development. We have with her as well Dr. Tiffany Hoyt, the Acting County Medical Officer of Health. We have Mr. Louis Lewis, the CEO of the Tobago Tourism Agency Limited. And off camera, we have with us to help with any questions that you may have posed to them. We have Dr. Victor Wheeler. He is the Medical Chief of Staff at the Scarborough General Hospital under the TRHA. And we have Dr. Roxanne Mitchell, the General Manager, Primary Care Services, TRHA. So at this time, I will invite to the lectern Councillor Tracy Davidson Celestine.
Thank you very much, Mr. George, and a pleasant afternoon to the members of the media, as well as to the listening public. I want to first and foremost ask all of us to take a moment to remember Ashanti Riley and all the other 46 women who lost their lives this year to violence, and in particular, domestic violence. And for me, none of these women should be a statistic, and they deserve our efforts solving their murders and bringing their perpetrators to justice. Our hearts go out to her loved ones whose trauma will not be over for a long time, if ever. As we prepare for the Christmas rush, we are luckier than most countries in that we have not shut down to avoid the Christmas rush, but we are preparing to welcome our Christmas visitors safely. And so as we slowly open up our economy, we all need to be mindful that COVID-19 is still a clear and present danger. However, our preparation for the Christmas season is underway with close collaboration with all of our stakeholders, including the Port Authority, Airport Authority, the Tourism Agency, and the tourism industry, as well as the police. Training, education, and awareness has been atop the agenda, along with the medical and operational sides of the systems that are constantly being adjusted and built out to anticipate the worst, but of course hoping for a safe and happy Christmas season. So we have quite a lot of catalysts at the moment for this holiday season, but it requires all hands on deck. It requires all players on board in order for us to manage this pandemic very well. But the biggest catalyst is, of course, the public's responsibility. We are here to help, but we need you to help us too. This can't work without you. We have to do the right thing at the right time. We have to be in a position to protect our loved ones, and we, of course, in the process, have to protect ourselves. And so from the division, we will soon launch an additional public awareness campaign program and additional signage and reminders of COVID protocol. And please remember, members of the public, to all of you who are listening, that the fine for not wearing a mask is 1,000 TT dollars. I would now like to take this opportunity to invite our County Medical Officer of Health to present you with a status update on COVID as it relates to our public health approach here in Tobago, and she would also address or give a status update on our improved testing capabilities on the island.
Hi, good afternoon, everyone, and welcome. So the stats for Tobago as of today, Tuesday, the 8th of December, there were no confirmed cases detected yesterday. Currently, we have 22 active cases on the island. we've had 128 samples in total testing positive since the beginning of this outbreak, and that is from a total of 1,983 samples that would have been submitted for testing. So this graph, what it shows is that we've been monitoring the data with respect to COVID-19 and influenza-like illness. So influenza-like illness would capture anybody who would have presented to the healthcare system with any kind of symptom that could be related to influenza or the flu or any viral illness. So that includes headache, sore throat, cough, fever, body pains, etc. So when we look at the numbers recorded for influenza-like illness, if you look at the blue line, which represents the numbers recorded for 2019, you'll note that towards the end of the year, the right side of the graph, there was a marked increase in the number of persons who would have been presenting to the healthcare system with these symptoms. And I don't know if persons recall that we had a flu outbreak last year. Towards the end of last year, we actually had 3 recorded deaths from influenza, and there was a total of 40-something recorded deaths for Trinidad and Tobago, 3 cases in Tobago. Now, if we look at the orange line, which is the number of persons presenting to the healthcare system with those same symptoms for this year, 2020, you'll note at the start of the year, we had higher numbers, and then there's a marked drop, and that represents the time when the public health measures were put in where persons were asked to stay home, to practice hand washing, not touching your face with your dirty hands, etc. So that showed, that led to a marked decrease in persons who would have presented with any symptoms similar to influenza or viral illnesses. And as we follow the trend, you notice that the numbers for this year, the orange line for 2020, have stayed much lower than compared to last year. And if you look at the gray line, which represents the number of confirmed cases we've had for COVID-19, you notice that it follows a pattern. At times when we have, if you look at the orange line, which is also for 2020, the times when we have increased number of persons presenting with the influenza-like illness symptoms also correspond to the times when we have increased number of cases being detected. So what this graph shows is the number of cases that would have been detected from October of this year till now. So it shows, I just wanted to point out, we had spikes along the way, and they were related to particular events. The largest spike we would have had would have been when we had the outbreak at the prison, at that time when we had 5 officers and 13 inmates testing positive. Just to note, there was a period, if you look at the line, when there's a long period where there's a flat line, and that would have been the period over a 28-day period where we would have reported that we had no confirmed cases detected. Now, a lot of persons have asked, so how come we went from no confirmed cases to then suddenly having cases? And I want to use this opportunity to address that. So at the various press conferences, the Secretary of Health and the other members of the team would have indicated to persons that although we were not getting any confirmed cases, the community spread of COVID-19 was ongoing. So persons should not become complacent. So persons need to remember that although no one who presented to the healthcare system to get tested was detected as having COVID-19, it doesn't mean that it's not still present and very much present in the community. In fact, because a lot of persons who get infected may not have any symptoms or have very mild symptoms, they may not have come forward to get tested. So although we may report that we have not detected any confirmed cases, it does not mean that cases of COVID-19, persons infected with COVID-19, I should say, are not present in the community. So we also want to remind persons that you can become infected with COVID-19 not only from being in direct contact with someone who has COVID-19, but you can get COVID-19 if someone who has it has passed through an area, they have infected a service, whether it be a door handle going into a shop, a pen, those who travel in taxis, the door handle to go into the taxi, etc. So if these surfaces have been contaminated and the virus can survive for some time on surfaces, and then persons touch these surfaces, and then you touch your eyes, nose, or mouth with your dirty hands without washing your hands, then you can become infected. So please be mindful. Always, always, always practice the public health measures. And also note that persons are going from Tobago to Trinidad to shop for Christmas. We have persons coming up from Trinidad to vacation. So your exposure, your risk of exposure is the same, regardless of whether you're in Trinidad or Tobago. Be mindful, never forget to stop practicing the new normal. Wear your mask, wash your hands, especially before you touch your face, and social distance, because at the end of the day, it's not enough just to wear your mask. Wearing your mask goes along with keeping your physical distance from persons. So I just wanted to reiterate that for persons who were alarmed that we went from having no recorded cases to now again having cases. So when we look at the distribution of the cases that we've had for Tobago, our confirmed cases, there's almost an equal distribution between male and female, but we had a slightly higher number of males. We've had 53% of our cases being male and 47% being female. When we look at the distribution of the age of our cases, our youngest case was as young as 5 months old. Our oldest case was an 84-year-old. But the majority of persons for the confirmed cases in Tobago fall within the age group of 30 to 39 years. Well, just to note, for the persons in Tobago who would have tested positive, while 75% of them had symptoms, 25% of them were asymptomatic. So what that means, these persons were infected with the virus, able to spread the virus, but had absolutely no symptoms. So again, please be mindful. Don't take it for granted that, oh, this person works with me, this person is my co-worker, so I don't have to take protection around them. Persons may not have symptoms and can still spread the virus, so at all times, practice the public health measures. And this last depiction shows the distribution of the cases throughout the island. The majority of the cases are on the southwest side of the island, but it gives an idea of how the cases have been distributed. The last thing I would like to speak about is with respect to our testing in Tobago. So our testing, the turnaround time for getting results has drastically improved. So now persons who are tested can usually expect to get results within a 48-hour period or less. And the antigen testing is soon going to begin. And I want to also take this opportunity to announce that the Division of Health has sought to put things in place for persons who need to get tested for the purpose of travel. We recognize the difficulty in persons having to go to one of the certified labs in Trinidad to get the test done before 72 hours, come back, then go to travel. So what we have put in place so as to make it more convenient for persons in Tobago who have to travel internationally and have to have that PCR test done within 72 hours is that the details of how it will be done will be put out, whereby persons will contact the hotline. Once you have your date of travel, you'll contact the hotline, you'll be booked to get swabbed, which will be done at the green room, strictly by appointment. The TRHA, in collaboration with the division, will transport the swabs to the private lab, and the lab will email your results to you so that you can have your results within a 72-hour period. Please note, the division is not covering the cost. This is being done by a private lab. So persons have to, of course, make the arrangements with the lab, pay for their tests, and then we will facilitate having you get your swab done here and the samples transported to Trinidad so you don't have to do that back and forth. So thank you very much, Secretary. That's my update.
Well, thank you very much, County Medical Officer of Health. And one of the messages that's coming loud and clear from Dr. Hoyt's presentation is that we are all asking you to not become complacent, because our relatively low numbers in Tobago does not necessarily mean that there is no COVID out there in the communities. And so we are encouraging all of the members of the public to pay particular attention to the health updates, but more than that, to continue to practice the protocols as it relates to wearing your mask and practicing sanitary conditions. We did indicate that we are having collaboration with a number of different stakeholders: the Port Authority, the Airports Authority, and the Tourism Agency, because we know that we are coming very close to the holiday season, and so it requires all players on board in order to ensure that our systems are very effective. And I would now like to invite our director of the Tobago Tourism Agency Limited to talk about their presentation from the perspective of tourism and how they have been working with their industry partners to help to manage the spread of COVID in Tobago.
Thank you, Madam Secretary. From a tourism perspective, we are beginning to see some signs of an uptick from the domestic market. We are actually seeing a few more people coming across on the air bridge and on the sea bridge. And those two are connected with the fact that there is additional capacity associated with the easing of some of the restrictions that have taken place over recent times, and people are actually coming across to Tobago for vacations. We did a bit of a forecast by contacting a number of the accommodation establishments, and we are actually seeing an uptick in the demand, and we anticipate that we will see a reasonably good number of people over the Christmas season, because a number of properties are featuring that they are receiving bookings. Of course, the situation is not uniform across all. There are some who are doing better than others. Particularly, one of the trends that we've observed is that people are opting for private accommodation. So that segment is featuring a better performance than the established places of accommodation. So that is something that we need to monitor. Of course, we are also concerned that the movement or the additional movement of persons does not result in a spread of the virus. And we are actually working in very close collaboration with the Division of Health and also the various stakeholders to ensure that they put the necessary protocols in place so that visitors can be assured of a safe entry and exit and having a vacation in Tobago. We all know that tourism is the lifeblood of the economic lifeblood of Tobago, and we want to ensure that there is a smooth participation in those activities that bring us the revenue that we earn. We also are working with the Division of Health again and with CAFRA for the establishment of protocols for providing hospitality services. So last Tuesday, there was a training that was spearheaded by CAFRA online for a number of service providers. We had about 51 participants logged on to engage in the training. It's less than we anticipated, but there will be more, because assuring a potential visitor a safe entry and exit is what is actually going to drive business. The most important marketing message that's out in the market now is how safe, or what safety features are being presented to give visitors the satisfaction and the assurance that there's a minimal to no risk of them participating. So there will be additional training, and we've struck a very happy medium, a balance between the requirements for the health protocols, for the certification being spearheaded by CAFRA, as well as the acclaimed World Travel and Tourism Council Safe Travel stamp. It's not a duplication, it's not a competition, but there's a synergy between the two So access to one almost automatically gives you access to the other. One is targeted at the potential visitor, and the other one, which is the WTTC, is targeted at the tour operators when we do open the borders. So there's a synergy of those two programs. We also have kept very close contact with all our major airline partners. This morning alone, I had meetings with Virgin Atlantic and also with Condor, just keeping them in the loop, because Tobago will open at some point in time, and what we don't want to find ourselves in a situation where we don't have international air access. They are very encouraged by some of the initiatives being spearheaded by the Division of Health in terms of the health and safety protocols and how we are adhering to those principles. That is a major concern for anybody doing business from the international market, and we are keeping that in place. The last thing I just want to mention is that while the borders are closed, because of the importance of tourism, we are keeping Tobago relevant through our social media platforms, and at the same time, we are working closely with the stakeholders in ensuring that the quality of the product we have is competitive once we get out of the restrictions. And you would know of the popular accommodation grant, where at least 100 and a little over 100 properties have actually taken advantage of it. But then you also are working with the service providers, looking at ways in which they can augment their tours or identify good value, so that when we do open up and we interact with visitors, there's a good value for money proposition that we will be able to deliver on. Our main concern, as I said at the beginning, is to ensure that as a tourism destination, that we can facilitate safe travel, and that is what we are focusing on. So that's the update from the agency.
And thank you very much, CEO. And I want to shift gears a little and to draw attention to the mental and emotional plight of children during this ongoing pandemic. And sometimes we tend to think that children are resilient, but life is not now normal for them. We need to also hit the reset button for our children. And so I would now like to invite our primary care manager, Dr. Mitchell, who would shed some light on the practical side of managing the mental wellness of children.
Thank you, Madam Secretary. Good afternoon, ladies and gentlemen. As indicated, we are beginning to see some impact of the COVID-19 on the children of our communities. A lot of these issues are focused more or less on the mental health and the psychosocial effects of COVID-19. In particular, issues and challenges such as worry, fear, and anxiety is impacting on our children in a number of ways. The same frustration that our parents are experiencing, the same frustrations that our teachers are experiencing, we must keep in mind that our children are also experiencing. The frustrations that surround deadlines with regard to schoolwork, the frustrations that surround the mode of education delivery that we are experiencing as adults, our children are also experiencing. The same frustration that surrounds the steep learning curve in terms of the use of the technologies that we're employing are also experienced by our children. What we have noticed is that a number of children are spending a lot of time behind devices. They're spending a lot of time at tables, at desks, in enclosed areas. And this is beginning to impact on the mental well-being and the psychosocial well-being of these children. I would like to advise, going forward, that parents set established wake-up times for their children. Prior to COVID-19, we had a time that children woke to get ready for school, and I will suggest that you keep to those schedules. I would like to advise that we establish personal hygiene times. Our children need to have a shower at a specific time, morning and or afternoon. It depends on your own personal goals. I would like you to establish times for brushing your teeth, times for the children to brush their teeth. Our dental services have reported that we're seeing an uptake in terms of dental caries and poor oral hygiene of our children. Please pay particular attention to oral hygiene. It is closely linked to non-communicable diseases in terms of having the same risk factors. Reduce the sugary meals, reduce the sugary snacks. They are not panache. You need to ensure that children are eating healthy, just as before COVID. You need to ensure that children are engaging in increased physical activity. Just as a reminder, children ought to engage in 60 minutes of physical activity per day. Kindly ensure that you work that into their setting. And as we go into Christmas break, I am asking kindly, I'm urging that you ensure that children engage in increased physical activity. Also, we need to have some downtime for devices. Now, I'm not contradicting. We do need the devices for school, but we also need reduced time away from devices to ensure that children engage in social activities. They need to interplay with other children. They need to interplay with their peers in order to have a balance in terms of their mental well-being. Engage in play dates, whether it be supervised in terms of physical distancing, in terms of wearing of masks. But they do need to engage in those types of activities going forward. We will look a little more at some of these issues in some follow-up areas, but I just want to keep those tips in mind. Set your wake-up times, set your bed times, set your personal hygiene times, set your meal times, ensure children actually, are keeping away from the sugary meals and practicing oral hygiene. Thank you.
All right, thank you very much, and that's all for the presentations from our panelists from the Division of Health, Wellness and Family Development and the collaboration with Tobago Tourism Agency Limited. At this time, we'll open up the floor to questions from members of the media, and we all know the rules. Just raise your virtual hand once you have a question so that we can have some order, and you just have about 3 questions per round. So the floor is now open for questions from members of the media. Yes, Akin Labi, you could go ahead.
Good afternoon.
Good afternoon.
My question is for Dr. White. Dr. White, can you confirm whether fire officer attached to the Crown Point Fire Station tested positive for COVID-19? And can you say how many fire officers are currently in quarantine at this time?
So yes, fire officer attached to the Crown Point Police Station is one of the confirmed cases of COVID-19. The interviewed, and of those, 20 of them who were deemed to be close contacts to the officer are currently in quarantine. And I'd just like to use the opportunity to once again reiterate to all persons, please, 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 do not go to work if you're ill. If you're ill, stay home, call the hotline. Do not go to work.
Also, I have a follow-up question. Dr. Hoyt, can you confirm whether the officer that tested positive did go to work even though they were feeling ill?
Yes, so the person did present to work on the day of illness, but the workplace would have recognized and sent the person home.
All right. All right, Akinlabi, thank you very much. We move on to Elizabeth Williams. Good afternoon, Elizabeth.
Good afternoon, everyone.
Good afternoon.
Okay, I wanted to just get clarification from Dr. Hoyt when she was doing the percentages. I think she said in terms of Tobago, 53% males, 47% females. I'm not sure if I'm right. And 5 in terms of Tobago, a 5-month-old tested positive for COVID and 84-year-olds.
All right, Dr. Hoyt.
Yes, those are correct. Our youngest case was our youngest case to date, a 5-month-old, and our eldest case, an 84-year-old. And the proportion of males to females among the confirmed cases are 53% of them being male and 47% of them being female.
Okay, what I wanted to know from Mr. Louis Lewis, is he worried at all in terms of the border closure at this point? And has he received any negative views from our international partners with respect to airlines as to the Trinidad and Tobago's borders being closed? And my final question is for the Health Secretary with respect to BDU. Some of those persons in the BDU section in Tobago, they are saying that that's the business development unit.
Yes.
They are stating they have not received their gratuity since 2013, and they have raised this occasions, but it has not been.
All right, Liz, I just would ask the question again. So the final question, some persons from BDU haven't received their gratuity payments and you want an update on that? Is it that's your question?
Yes, thank you.
Thank you very much, Liz. Mr. Lewis?
Yeah, I'm not sure how to translate the adjective concern. However, the good thing about the bad thing is that the pandemic has affected the entire world. So we are not unique in the experience. It is something that is clearly being led. The direction of getting out of it is clearly being led by the health protocols. And if it's a situation of life versus livelihood, definitely life has to take precedence. And I think that is what is exactly what is happening. Having said so, there is a clear recognition that in the reopening of the borders, the safety of the visitor must be paramount. And what we have sought to do while we are ensuring those things are in place is to keep Tobago relevant. So we are in constant contact and dialogue with our airline partners. They understand the strategy, they understand the focus, and we are also keeping them in the discussion and the dialogue with what is happening from the health side, as well as some of the developments that are taking place from the tourism perspective. And what the closure of the border allows is for an opportunity and a time to refresh the product. And the government has made a facility, or should I say facilities available for some of the providers to take advantage of that, and that we are doing. So my interpretation of the concern is that I have an anxiety for when it opens that we will be able to do it, but that anxiety cannot be compromised by health and safety, which is what our focus is going forward.
All right, thank you. And the other question, I'm not sure if our secretary really could answer. BDU doesn't fall under us, but persons at BDU haven't received their gratuities. And
well, what I know is that the payment of gratuity is a priority for us, and there might very well be some operational challenges. But within each and every division, there is a team of officers who are working to ensure that we can treat with all the outstanding gratuity. And so I am sure that within a reasonable time period, that particular situation would be addressed.
all right, thank you very much, Secretary. Via WhatsApp, I have two questions from Whitfield Turner, I-95.5 FM. Both posed to Dr. Hoyt. The first question, how much longer will COVID samples be sent to Trinidad, and how has this impacted the turnaround time for getting results back to patients? I'll ask the second question after you answer.
Okay. So, with respect to samples being sent to Trinidad, you recall that the testing machine that we have in Tobago, the Gene Expert PCR machine, Trinidad and Tobago, neither island has any of the test kits. Central government is negotiating to get more kits, but there are no kits for the machines, and there are 3 machines within Trinidad and Tobago. So none of those machines are currently in use because the kits to be used with the machine are not currently available. So I can't give a time frame for how much longer they will be sent to Trinidad because we're not sure if or when we will get kits for the machine. However, I would have mentioned that antigen testing is soon to begin. So the exact date we don't know yet, but that is something upcoming. With respect to the turnaround time for samples, so that has drastically improved, and I think I would have mentioned that persons who are swabbed would usually receive their results within a 48-hour period.
All right, thank you.
And just to add to what Dr. Hoyt has just said, the issue for us should not be whether the samples are being sent to Trinidad or whether the samples stay in Tobago, but rather the time within which we receive the results to make meaningful decisions. And as Dr. Hoyt would have indicated, the average wait time has been reduced significantly, and within a 48-hour period, we have been receiving results within which we can to assist us in making very effective decisions on patients. So the issue is not where the test is being done, but the time within which you receive the response.
All right, thank you very much, Secretary. And before I ask the second question, I will remind persons that in addition to our panel that is visible here, we have Dr. Wheeler and Dr. Mitchell off camera. So the second question, within the past week, there were conflicting figures regarding Tobago COVID tally. While numbers from the division seems to add up, in one instance, the Ministry of Health reported 7 cases for Tobago on a day when the division reported only 3 cases. The following day, the division reported only 3 new cases. Please explain, as this confused a lot of people, and this is just one instance when it happens, which can cause people to question the data. Dr. White.
All right, so with respect to the reporting of the number of cases and tests done, etc., the Division of Health would usually send out the press release in the morning time because the statistics are sent out from the office of the CMOH in the morning, usually before 8 a.m. So the statistics that are represented from the division are effective from 10 p.m. the day before. So the reporting that is done by the ministry is done so as of 4 p.m. of the day. So between the morning period, or actually from 10 p.m. the day before to 4 p.m. when ministry sends out their results, if test results come back confirming new cases, you would find that those cases are captured in the ministry's 4 p.m. result, and it will be captured in the division's morning report the next day. So keep in mind that this is a fluid situation. Testing is ongoing. Results are released. And as results are released, because both the Division of Health and the Ministry of Health are trying to report in real time, you will get the number as of at the time of the press release. The press releases are not the same time, so the numbers are not going to be the same all the time. In cases where we have no new confirmed cases, you would find that there's the same number reported. But once new cases are detected, you will get a discrepancy in the numbers because the reporting is being done at different times.
All right, thank you very much, Dr. Hoyt. I have one more question from Elizabeth Gonzalez at Newsday, and it pertains the same fire officer. The addition is that from that case at the fire station, she understands that 100 officers were sent into quarantine. Can you say if any of the officers on quarantine are showing symptoms? And if yes, how many?
All right, so allow me to correct that information. From the officer at Crown Point Fire Station who tested positive, only 20 officers have been put on quarantine, not 100, only 20. And they're currently being monitored day and night, and no one has yet reported any symptoms. But all close contacts have been tested, and we continue to monitor them. And if persons develop symptoms while they're in quarantine being monitored, they will be retested. Because of note, we've had cases where persons are tested during the initial period of their quarantine. Then when they develop symptoms and they're negative, so they are kept in quarantine and they're observed. And then as we continue to monitor them, they develop symptoms, we retest them, and they test positive. So that is also a reminder to persons that someone testing negative at one point in time does not necessarily mean that they're not infected. It's just at that point in time, the virus is not detectable. And that's why we continue to monitor persons for the 14 days. We don't just release them after the negative test.
All right, thank you very much, Dr. Hoyt. Lois Vincent, Garden Media. Go ahead, Lois. Good afternoon, Lois. All right, we'll move on to Akinlabi Holder. Akinlabi, you could go ahead.
Good afternoon again.
Good afternoon.
Secretary, these questions are for you. A few questions. It's concerning repatriation flights and COVID procedures when those flights come in. Crown Point is classed as an international airport. Why are Tobagonians dropped off in Tobago on the CAL flights and the procedures that are done in Trinidad replicated in Tobago? Question number 2. Why is there nothing in place for Tobagonians to be able to quarantine at home for the final 7 days, as is done with their counterparts in Trinidad? Because apparently when Tobagonians come in, they have to spend 14 days in state quarantine in Trinidad, while Trinidadians spend 7 days in state quarantine and 7 days at home. And, well, I guess you answered the final question concerning the information on the press release.
Okay. The information on what?
The press releases, that was already answered. Thank you very much, Akinlabi Holder. And I'm not sure if this is Secretary or Dr.
So,
Hoyt.
Secretary, allow me to take the questions. So just remind me what the first
why aren't
question.
persons being dropped off in Tobago from those international flights? Why are these being sent to Trinidad?
All right, so if persons would recall the procedure by which the repatriation flights are being done, when persons are granted the exemption to return home and the flights are arranged, the majority of the persons are, because we do have persons from both Trinidad and Tobago, but the majority are coming from Trinidad. Given that flights are flying, not full flights, the airline industry have been hard hit. I think it's going to be very difficult to expect that they will come to Tobago to drop off 2 persons and then drop the other 70-something in Trinidad. So again, it's at the discretion of the airlines that are providing the flight service. The majority of the persons on the service are going to Trinidad, hence the flights would be going to Piarco International Airport. With respect to the other question about persons being quarantined, so let me just clarify that the protocol is, if persons are returning from what is deemed a low-risk country, based on the WHO definition, they are allowed to do 14 days home quarantine, and this applies to both persons from Trinidad or Tobago. So if we have any persons resident in Tobago who are coming from low-risk countries, they actually will be allowed to do the 14-day quarantine at home. The majority of flights have been coming from areas which are moderate to high risk, and all persons returning on those flights are required to therefore do 7 days state quarantine and 7 days of home quarantine. For persons resident in Tobago, they have done the 7 days state quarantine in Trinidad, and they actually have come across to Tobago. They do the 7 days home quarantine in Tobago, and they're monitored by persons of the surveillance units out of the office of the CMOH. So that is actually ongoing.
All right, thank you very much, Dr. Hoyt. I think I saw Carissa on TTT. Hi, Carissa.
Pleasant afternoon.
Afternoon.
Yes, so I have 2 questions, one for Mr. Lewis and one for Dr. Hoyt. Mr. Lewis, I recognize you highlighted that there was an increase on uptake in persons coming to Tobago from Trinidad. Do you have any numbers, any statistics, any comparisons as it relates to this period compared to last year?
Well, I don't have the actual data here with me now, but it would be what we know for a fact. And when I said an uptick, I'm comparing the growing trend that is moving commensurate with the easing up of the restrictions, or should I say the additional capacity on the air bridge in particular. So we've seen the numbers move. I wish I had the actual numbers here with me so I could give it to you, but I don't want to venture and give you, estimates. The comparison between last year at this time is that we were fully open and we were in what was a very progressive year. So, it would be almost unfair. You're not comparing like with like. But what is important for us is to see how it is moving as policy changes, and we are seeing an additional demand for Tobago coming from the domestic market, and that is what I was alluding to.
All right, thank you very much. Carisi, a second question, please.
Yes, no problems. Dr. Hoyt, I just need some clarification, please, as it relates to persons who have to have a COVID test done because they are traveling. What I'm asking is because someone had to travel, but they went to one of the health facilities to get this test done, and they were told that they have to pay, they have to make a payment, but they were startled. They said that Carl didn't highlight that to them, they didn't know that they had to pay, and they were a bit irate. So for persons like that lady who felt that way, could you just provide some clarification and explanation as to what is the procedure once you have to travel? I know you highlighted some of it, but could you please just reiterate the point?
Okay, so for persons who are departing the country for international travel, most of the airlines, and let me just say that persons should always check with their airline to confirm that it is a requirement, because there are actually a few cases where it may not be. So first and foremost, anybody who is traveling out of the country, at the time when you are purchasing a ticket, make sure and inquire what are your requirements for travel. Most persons, however, are being asked to provide a PCR test, and within a specific window of 72 hours. The policy, the national policy, is that persons who are requiring tests for the purpose of travel have to acquire those tests through the private institutions. There are 3 private labs that have been certified to do those tests, but all the labs are based in Trinidad. So, as I would have indicated, for persons from Tobago who want to travel internationally and require the tests, what the Division of Health in collaboration with THA is facilitating is that once you contact your lab, we are not directing you to any particular lab. The choice is yours. You contact the lab, you make the arrangements, you make the payment to them, you then contact the division's hotline 800 HEAL, provide your information, you'd be given an appointment to get tested, you present proof of payment, the swab will be taken here at the green room, then the sample will be taken to the private lab, and then they will send on the results to you. So for anyone who requires testing for the purpose of travel, you do have to pay to get that test done. That's for anyone across the board, because you have to access that facility through one of the certified private labs.
All right. Thank you, Dr. Hoyt. The last 2 questions. Lois Vincent, you could go ahead again. Good afternoon, Lois. All right, and the final questions from Elizabeth Williams.
Okay, good afternoon again.
Good afternoon.
I just have one question, and that is with respect to the MRI machine. Any timeline as to how soon it will be delivered?
Right, sir.
Well, the situation is that tendering for a company to refurbish the machine, that process has actually started, and as soon as the information has come to hand, an evaluation will be done, and a contractor will be selected. The important point is that the process has started, but there is no definite date yet as to when the process and the refurbishment of the machine will take place. But the TRHA is very committed to having that machine up and running within the shortest possible time frame.
All right, thank you. And with that, I'll invite Secretary to just give you final comments before we close.
Well, thank you very much, Mr. George. And coming out from the press conference today, there are very clear messages. One, that there is collaboration taking place at the level of all of the respective stakeholders, because we are very well in preparation for the upcoming Christmas season, and we know that there are quite a number of situations or circumstances out there in the public domain that can easily lend itself to the spread of the virus. One, we have quite a number of persons coming to the island because of the reopening of the economy, so to speak, and persons will be coming for vacation and otherwise. We have quite a lot of persons who will be traveling to Trinidad in preparation for the upcoming Christmas season. And we also have the Tobago House of Assembly elections right around the corner as well. And so the message is that we always have to be on our guard. We have to pay attention to all the messages that are coming from the respective organizations. That would be the Division of Health, Wellness and Family Development, the THA, as well as the Ministry of Health and the central government, so to speak. And then we always have to ensure that we follow those health protocols as much as is possible in order to mitigate and in order to manage the spread of the virus out there in the communities. And I want to reiterate the point that no recorded positive cases on the island or low numbers does not necessarily mean that there is no COVID present. So let us not be complacent. I understand that persons are still having birthday parties, persons are still having Zesa parties, but we are encouraging you as much as is possible to ensure that you stay at home where that is necessary, and of course to wear your mask as much as is possible. And we continue to care about all of you who are experiencing hardship, those of you who are very vulnerable. Some of you may have lost your jobs in the process. We have businesses that continue to be feeling the effects of the COVID. You have support from the Division of Health, Wellness and Family Development, also from the Division of Tourism and Culture and the respective agencies, as well as the Business Development Unit and all of the Tobago House of Assembly. So we will play our part, but in the process, we also expect the members of the public to play their part, because at the end of the day, we are very familiar with that old adage that says one hand really cannot clap. And in this process, it has to be all hands on deck as we move forward to fight this monster.
All right, thank you very much, Secretary. Just one quick thing, I remind persons that we are still in the flu season, so visit any of your nearest health centers to get your flu shot if you haven't gotten it as yet. As the Secretary would have indicated, wear your mask. Remember, there's a fine of $1,000, which I'm sure no one wants to throw away $1,000. So please ensure, especially in this guava season, so please ensure to wear your mask, avoid having that fine of $1,000. And I just remind all our men, in light of all that has happened in this country within recent times, where domestic violence is concerned, please let us love our women, let us protect our women, and let us just keep them safe. So thank you very much once again. It was a pleasure having you here with us at this week's media briefing. Have a wonderful afternoon and be safe. Thank you.